Welcome, everybody. My name is Professor Rachel Porter. Today I'm going to be talking to you about medical abbreviations. It's a foundational skill that you'll use throughout your nursing career, and understanding of medical abbreviations, when to use them, how to use them, and what they actually mean. As LPN students, you'll quickly realize that healthcare professionals communicate using a specialized language, specifically medical abbreviations. It's like a form of shorthand that healthcare professionals use to tell the patient's story. They help communicate effectively, document patient care, share information across healthcare settings, and by the end of this session, have a better understanding of the common abbreviations, how to interpret them correctly, and how to avoid dangerous mistakes. I'm going to start sharing my screen with you now, so bear with me 1 second so you guys can follow along. I lost my mouse. There it is. Bear with me, guys. Bear with me. There it is. Okay. So why abbreviations matter? Medical abbreviations matter because healthcare is a fast-paced environment. Nurses, physicians, and therapists and other healthcare providers often need to communicate quickly and accurately. Abbreviations improve efficiency by reducing the amount of time needed for charting and for documentation. They facilitate communication among members of the healthcare team and help standardize documentation across department facilities. However, abbreviations are only useful when everybody understands them correctly. One of the themes that you'll hear repeatedly throughout nursing school is patient safety. While abbreviations save time, they can also create confusion if used improperly. Knowing which abbreviations are appropriate and which should never be used is an important nursing responsibility. Before we go any further, let's distinguish between abbreviations and acronyms. An abbreviation is simply a shortened version of a word. For example, VOL stands for volume. An acronym is a form of the first letters in a series of word. For example, a CBC stands for complete blood count, which is a blood test. In healthcare, you'll encounter both constantly. Whether you're reading patient records, medication orders, or lab results, you'll need to recognize and understand these terms quickly. Let's look at some common abbreviations that you'll encounter during your clinical time and in practice. You may see the location abbreviations such as ED for emergency department or ICU for intensive care unit. Patient condition abbreviations also include A and O, meaning alert and oriented, and VSS, meaning vital signs stable. Laboratory abbreviations such as CBC, BUN, H&H are frequently used when discussing patient status. You'll also need to recognize anatomical abbreviations like RLQ and LLQ, which stand for right lower quadrant and left lower quadrant, as well as measurement abbreviations such as MG, ML, KG, and MCG, which stand for milligram, milliliter, kilograms, and micrograms. Don't worry if you don't know all of these today. Mastery develops over time and through repetition and clinical exposure. So not all abbreviations are equal. Some can have multiple meanings depending on the context in which you're using them. For example, PPD, depending on the context, may refer to postpartum depression, purified protein derivative, if used during tuberculosis testing, or packs per day when documenting a smoking history. This is why nurses must always consider the context in which the abbreviations are being used. The patient's diagnosis, location, age, and reason for treatment often help determine the correct meaning. Another example is ED. Many of you immediately think of emergency department. However, ED can also refer to eating disorder, erectile dysfunction, education. Imagine documenting care incorrectly because you assume the wrong terminology meaning. This could lead to misunderstanding and potentially affect patient care, which is never a good thing. Remember, safety, safety, safety. You want to make sure that you're always verifying the meaning based on the clinical situation. TX is another medical abbreviation with several possible meanings, including treatment, therapy, transfusion, transplant, transfer, and traction. As future nurses, never hesitate to ask for clarification. Patient safety is always more important than appearing knowledgeable. If you're unsure about an abbreviation, always verify it before acting on the information. Some abbreviations have been identified as unsafe to use because they're commonly misread and contribute to medication orders. For example, QD for daily and QOD for every other day can easily be confused. A missing or misplaced decimal point can change a medical dose directly or dramatically, excuse me. To reduce errors, healthcare organizations follow guidelines from the Joint Commission and encourage providers to write out these instructions completely. As students, developing safe documentation habits now will benefit you throughout your career. Additional dangerous abbreviations include U for units, which can be mistaken for a zero or the number 4. You may be confused with IV. MS can mean morphine sulfate or magnesium sulfate. Similarly, MsO4 and MgSO4 may be confusing with one another. Medication administration is one of the most critical nursing responsibilities. Small documentation errors can have significant consequences. Therefore, many facilities require these items to be written out completely. This is a live link at the top of the heading on the slide in blue. It will take you to a list of the do not use abbreviations as recommended by the Joint Commission. So now that we've had a little bit of discussion about medical abbreviations, let's put our knowledge into practice. Healthcare terminology is learned best through the use and repetition as we work through these examples. Focus on translating abbreviations into complete clinical language. I want you to take a few minutes and pause this video and work through the medical terminology and abbreviations worksheet that is linked here. You can go ahead and pause now. Okay, we're back. Practice 1. 72YO male admitted to the CCU HX of CHF and hypertension, HTN. Patient reports worsening SOB times 3 days, VS stable, ordered Lasix 40 mg IV stat, monitor INOs Q4H, labs up arrow BUN/CR. Take a few minutes here and pause and go work through that, see what you come up with. Okay, we're back. The correct answer is a 72-year-old male admitted to the critical care unit, history of congestive heart failure and hypertension. Patient reports worsening shortness of breath for 3 days. Vital signs are stable. Ordered Lasix, which is a diuretic medication, 40 milligrams intravenously immediately. Monitor intake and output every 4 hours. Lab results show increased blood urea nitrogen and creatinine. How well did you guys do? Here's another one. The patient is a 45 YO male, admitted for admitted post-op for effects of R ankle repair. HX of DM type 2. Patient reports pain level 8 out of 10. PRN pain meds. VS staple. Orders include NPO until BS return. Monitor INO Q2H. Needs assistance with ADLs. Pause, pause this video now and see how well you do. Okay, we're back. The correct answer is the patient, is PT, is a 45-year-old male who was admitted postoperatively for a fracture of his right ankle repair. Their history includes diabetes type 2. The patient reports their pain level is 8 out of 10 and they need as-needed pain medication. Their vital signs are stable. Orders include nothing by mouth until bowel sounds return. The nurse needs to monitor their intake and output every 2 hours. The patient also needs assistance with activities of daily living. Here's another practice one. I want you to fill in the blanks. You could take a few minutes, pause this video, and write your answers down, and we'll go over them at the end. Okay, inflammation of the kidneys is called nephritis. High blood sugar is called hyperglycemia. Inflammation of the joint is arthritis. A rapid heart rate is tachycardia. Surgical removal of the appendix is an appendectomy. And surgical removal of the tonsils is called a tonsillectomy. How well did you do? So as we conclude, we want to make sure that we remember that no one begins their nursing career already fluent in medical language. Learning medical terminology and abbreviations is a process that develops through study, practice, and clinical experience and repetition. It is like learning a new language, so give yourself some grace. Your goal is not to memorize every abbreviation immediately. Instead, you want to focus on becoming comfortable with the common terms, know your resources and how to use them appropriately, and always prioritize patient safety when documenting and communications are involved. We're excited to have you join our LPN program. You'll learn a tremendous amount over the coming 10 months, and today's discussion is just the beginning of your professional nursing journey. Welcome to the program, and we look forward to helping you become a safe, knowledgeable, and compassionate nurse. See you in the fall.